Hi, my name is Sydney Stern, and I have an amazing patient with me, Ann Kable, and we're going to talk about her journey. So, Ann, I'm going to let you introduce yourself and please start sharing how you got diagnosed and were you in pain before and anything that led you to diagnosis.
Thank you, Sydney. Yes, I back in 2019, I had what I thought was a ganglion on my right thumb, and my GP referred me. It kept getting larger, and it was quite painful. If I knocked it, it was limiting my mobility in the joint of the thumb. And she sent me off to a hand surgeon who um, agreed to operate and remove the ganglion, which was great. He decided to do it under local anaesthetic, but in theatre. So I was there with the whole screen, and my arm out like this. And he had a registrar there with him, or a trainee, I forget what they call them, who he was talking through as he was doing the operation. And all of a sudden, I heard him say, that's not what we expected, which I thought was pretty, hello, I'm here, I can hear you. Oh, sorry, forgot you were still awake. Anyway, he said after the operation, I suspect it might be a giant cell tumor, but I'll send it off for pathology. And it came back, unbeknownst to me, it came back with a diagnosis of tenosynovial giant cell tumor, but he, from that point on, only ever referred to it as a giant cell tumor.
So, for those listening, giant cell tumor is an umbrella term. It is not a diagnosis. Giant cell cells, which are fused of two different types of cells, are present in giant cell tumor of the bone, as well as tenosynovial giant cell tumor. These are two very unique entities, and they're distinct in that they're not the same disease. Giant cell tumor of the bone is a bone tumor that starts or originates in a specific area of long bones. It is characterized by a H3F3A mutation, which potentially drives the growth. TGCT is a soft tissue or mesenchymal tumor that grows in the joint or the joint capsule, the tendon sheath, the bursa, and it is characterized by a overexpression of CSF1, and these are very different diseases. So despite the shared giant cell tumor naming, they do not share treatments and they do not share systemic therapies like denosumab versus some of the other CSF1 inhibitors. And they also don't share treatments as far as surgery. So just for some clarification as well.
So then in the ensuing years, that was July 2020, I had that operation because I was meant to have it in 2019, but COVID, and theatres, given that they didn't think it was an urgent matter. And subsequently, pretty well every 12 months for another 3 years, I had a recurrence and more surgery. So in total, the hand surgeon, orthopedic surgeon, did 4 surgeries on my thumb. At that point, decided that surgery was no longer an option and referred me off to radiation oncology in my local. I live in regional New South Wales, about 5 hours drive from Sydney, and we have a very good cancer care centre here. So I was referred off to the radiation oncologist with the option that there were sort of 4 treatment pathways that we could potentially go down, radiation being one of them, which the radiation oncologist decided wasn't a viable option and then referred me to medical oncology for potential denosumab treatment. Off I went to the medical oncologist, and the first meeting I had with him, or the first appointment, I had a intern take my patient history, and he was really interested and asking me lots of questions. And at no point did I think to question it was giant cell tumor or otherwise, because you believe the doctors.
So were you
So
at diagnosis that it was giant cell tumor of the bone, giant cell tumor as just, or TGCT, tenosynovial giant cell tumor?
all the correspondence, he simply refers to it as giant cell tumor. Jumping ahead a little bit, when I decided that I wasn't sure that I was on the right treatment. And thanks to the support group, I first joined the GCT support group, and at your suggestion, started questioning that I might be on the wrong treatment, and it might be, I think whatever I'd put in there, you obviously suspected it didn't sound like GCT. So I started requesting all my medical records so I could look back, and I started doing some research, which took up a significant amount of my time. But I was convinced that I had TGCT, not GCT. And when I got the medical records, I was very surprised to see that the very first surgery, the pathology came of tenosynovial, giant cell tumor. And subsequent correspondence from the orthopedic surgeon um, used the term giant cell tumor.
What was the impact in your day-to-day life of being essentially misdiagnosed, mischaracterized for giant cell tumor of the bone when you had tenosynovial giant cell tumor?
Yes, I've just started reflecting on that um, because it wasn't until, so I had 12 months treatment on denosumab injections. And so just simple things like there were physical impacts, um, absolute severe fatigue the entire 12 months, which I didn't realize how severe it was until after I stopped the treatment. I was having an afternoon sleep nearly every day, and then sleeping a full night's, usual 7 to 8 hours. I had muscle aches and joint pain, which was more severe in the first week of after the treatment. So those physical impacts. What else did I write down? Brain fog. Because I was so tired, I'm guessing. So real memory problems, cognitive impairment, the sort of confusion and inability to make decisions compared to what previous to the treatment. Um, it also impacted on my ability to physically participate in many of the activities that I love doing. And just the hours spent sleeping took away from, that. There was financial impacts as well, because for me to go to the cancer care centre for treatment is a 2-hour round trip to the local closest cancer care centre, which really ends up being a whole day out of, your employment. I'm self-employed, so I didn't have any problem with having to take leave, but it meant that my working hours, potential for working hours, was diminished. Um, and I also spent an awful lot of time researching and reading about both diseases before realizing that I was on the wrong treatment. Um, Not regular, but twice during the treatment, OPG x-rays of my jaw to make sure there was no necrosis occurring. So that was an ongoing thing that would have continued. So the cost of those dental appointments was another financial impact. But I think the most significant thing was the psychological impacts it had on me. I was diagnosed back in 2005 with breast cancer. I had surgery followed by radiation, chemotherapy and radiation therapy. So having to go to a cancer care centre for a monthly injection that isn't you know, it it is a sarcoma, but it's not a, malignant disease. It was really triggering. And I often said so in the lead up to the appointments for a few days, I was feeling quite anxious. And despite the fact that in my head, I knew I had no reason to be. But having had that past experience, obviously, that had a significant impact as well. Mm.
So, what was the turning point that caused you to join the group or to find other providers that may be able to answer some of these questions?
Well, I just obviously when you as the algorithms help on Facebook and Instagram and whatever, something popped up and I went, oh, there's a support group. Great. So I joined the giant cell tumor support group, thinking that's what my diagnosis was, and started interacting there and telling my story. And then once I had some discussions with you, I decided to join the TGCT group and started hearing people's stories and thinking, hang on, this sounds much more like me, as you had suggested. And that's when I started jumping in and doing a whole lot of research and looking at medical, research papers and so on, um, as part of that. And I was convinced by that stage, probably a month or two after joining first joining both support groups, I was convinced it was TGCT. So at my next appointment, follow-up appointment with the oncologist, I decided to ask for a second opinion and discuss it with him. And I tried to approach it in a way was, I'm not necessarily questioning your diagnosis, but here are my concerns, and I would like to have a second opinion. And at your suggestion, and thank you for that list, Sydney, of the surgeons, I asked him to refer me to the Chris O'Brien Lifehouse Centre which is, a specialist sarcoma treatment, multidisciplinary team. So he referred me to them, and I was in the process of making appointments and so on when he rang me and said they've actually asked me to present the case, and is there any need for, they had said to him, was there any need for me to have to travel to Sydney every time I needed treatment? I'm glad they asked that question because that's a big, big ask. Um, and so they asked him to present to a multidisciplinary team meeting, at which point he did, and they agreed that I was on the incorrect treatment. I reread the letter that he sent back to my GP about that meeting, and I've also requested those documents, but I haven't got them yet. It says they decided that there was no evidence of further recurrence on my most recent MRI. Good, because he sent me off for another MRI. And then there was no role for surgery nor any further systemic therapy. No, doesn't help with a misdiagnosis, though.
Oh, no, it doesn't. You've been such an amazing advocate for yourself, especially being able to ask all of these doctors for essentially what you need and asking for records and all of these, which is never
Mm,
easy for anybody. What
yeah.
advice do you have for other patients who may find themselves in the same position or even other positions where they really need to advocate for themselves?
I think is to ask the questions, and particularly if you've got any doubts at all or you don't understand, to ask for things to be explained. Like I can't read an MRI report except for that bottom, recommendation or outcome that they've put at the bottom. The terminology is way above my my education level, um, or expertise, I suppose is the word. Um, so yes, you really do need to advocate for yourself. And I actually said to, oh, I nearly said his name, the medical oncologist, I will never leave a doctor's surgery again without a copy of my record because, and you have well, certainly in Australia, I don't know how it works elsewhere, but we have a right to have those records, and don't be frightened to ask for them. They're your records, and that can often shed light, as it did in my case, that way back 4 years ago or 5 years now, that I was diagnosed correctly based on the pathology and the first MRI I had.
That's very true, is that your
Mm,
records and your data is by far the greatest way you can get information and interact. And
mm,
thank you so much for that advice.
mm.
You did ask for a referral, a second opinion, essentially. Do you recommend other people find multidisciplinary teams or
Oh,
how they navigate that system?
absolutely. And I was reflecting on something that my medical oncologist, who I've decided that I will continue, have him monitor me. And I'm hoping that, well, I haven't seen him since. I'm scheduled for a follow-up MRI to ensure there's no recurrence in September. But I'm going to ask that he does liaise with the Chris O'Brien Lifehouse, the medical oncologist down there who specialises in it. So I've decided to stay with my existing medical oncologist, but he's very clear now that I'm going to ask lots of questions and I'm not going to always believe what he says. Yeah.
You're an amazing person and not only educating others, but also making sure your story's heard. And so thank you so much for sharing it with me and sharing it with everybody else.
Oh, not a problem. Thank you for your support that you provide. It's just, I am continually amazed by the amount of time and effort you put into the support group and responding to every individual pretty well immediately. Do you ever sleep?
Thank you. Thank you. No, my husband would say I don't.